right, good evening, everybody. Thank you for watching and attending. The previous minutes from the previous meetings I was unable to print out to bring with us today, so we will review those again by email, and I will have them printed for the next meeting so we can approve those, because I think the board members may have gotten the email to review them, but we don't have a printed copy here for Mr. Taltone and for the rest of this of the public to approve of. So the November meeting, we will be approving three sets of minutes, this meeting's minutes, plus September and the previous June. So we'll start with Mr. Taltone, if that's okay, for the health officer's report.
For the month of September, we had 22 food safety inspections, inspected 8 bathing places. I had 11 quality of life issues. 4 of them were resulting from dogs having contact with raccoons. 2 of those raccoons tested positive for rabies. We had 1 dog bite to a human. I had a situation where I had a senior citizen in a rental housing unit. Her air conditioner was broken, and her landlord was giving her a little bit of a problem, was getting that corrected. We took care of that. Some weeds and noxious growth and moisture infiltration, which is how we deal with the mold issue in apartments, because there's no regulations either on the federal, local, or state level to deal with mold itself. We had 1 apartment that was in unsanitary condition. We had to deal with that, and some complaint about rats. We have some new food establishments. Zoe's Kitchen. If you remember, it used to be Couz's on the west end of town. It's now open again. It's sort of a healthy type restaurant. Get a lot of salads and that type of thing. And we have All Seasons Produce down on 912 Conestoga Road. Under review is Autograph Brazier, which is going in where the old George's restaurant used to be. I also have been told to mention that available to the Board of Health is the recording room here for 411 Board of Health topics. We used to be, utilize that function a lot in the past, and I was also wanted to bring to your attention that it's still available. And it's also available for residents to contact me for topics that they want the Board of Health to address at my email address at ltaltoan@radnor.org, or by calling me 610-688-5600 extension 148. So that's my report.
Thank you, Mr. Taltone. Moving into some older business from last month, we'll sort of review, kind of going along with the health officer's report, any updates on the Yangming food establishment. Linda, were you at the meeting, at the inspection?
Yes, I did attend on Thursday, October 10th with Larry, and it was quite an experience, I have to say. So I was very privileged to be able to go and see how the food inspection process really works. And working in a hospital for almost 30 years, it's kind of similar, the inspection process with Department of Health and Joint Commission and things like that. So it was very interesting. I have to say, I want to commend Larry on his strong leadership and how he handled the whole inspection. I was really impressed how professional he was with the manager as well as the owner, and there were some issues noted at that time. So we ended early, probably about 20 or 30 minutes into a 3-hour inspection is what I understand takes place. So it looked excellent. The kitchen from, layperson's perspective, the kitchen looked immaculate. So however, I don't know if Larry, there were some issues downstairs, which I think have been rectified, so Larry can speak further on that.
Yes, during that inspection, there was some issues identified by the building inspector. Most of them were plumbing and some electrical issues. There needed to be a couple of expansion tanks on the hot water heaters, and some junction boxes that had exposed junction boxes, which is not permitted. So those things needed to be corrected. We also went back today, and they actually passed, so they are available to open up as we speak. So they did pass today.
Larry, the timeline on that was they were inspected a number of times. Was it 3 times that it took, or 4 times?
I believe the number is 4 off the top of my head.
Okay. And there was some emailing going on with the Board of Health members during this month period. Do you know if there's any, is there a fee paid by a restaurant that needs to be re-inspected when this kind of thing happens?
Yeah, that's one of the things that I was talking about with my supervisor, and I have to wait for him to assess and make a determination. But after the second inspection, or after the first follow-up, I should say, we can assess an inspection fee of 2/3 the amount of the license. And
Of
that license-
2/3 what?
The amount of the license. 2/3 the cost of the license, which is, the license fee is based on the number of seats you have in a facility. So, for example, if that facility license costs $600, then we would pay 2/3 of that fee after that first inspection. But I will say that, in addition to that, they do have a few, at least 4 summary citations that I wrote. So there's a hearing scheduled for, I think it's Thursday of this week. So I won't speak too much about that, because I don't want anybody to hold anything against me at the hearing.
And that hearing is with whom?
It's at the district court
Okay.
for citations that I wrote.
Well,
And-
go ahead.
I'm
No,
sorry.
you go ahead. You go
Apologize to interrupt you. So there is there should be a fee assessed for this number of inspections that should have been taken care of initially. And I guess the other concern would be, of course, how do we maintain compliance with a restaurant that has failed inspection? And that has been another topic that's been kind of going around in emails and on the Board of Health. And I think before everybody else kind of gives their opinion, I know Mr. Zinkowski and I have, and Marianne and I spoke at that meeting, and eventually there's going to be some sort of, documented system we have in place for the future when these things sort of happen. But in the meantime, I think Marianne was concerned that, should we go back there, and should it be something that we go back and inspect randomly to see if they're complying to
I can assure you that will happen.
All right, well, my concern is, and I know Mr. Tautone, I spoke with him prior to the meeting, that he does not have the time for weekly inspections, for putting the Yang Ming on probation for a year. That would be my recommendation, and that Mr. Zinkowski get you the help you need so that people would pop in and check on them, because just randomly I found out today that this has been going on far longer than we knew about as a township. So that would be my request to the township manager and your boss, that they be on probation and they be checked weekly. It would also be very important to the citizens and the taxpayers of this township that they are fined for each subsequent violation where all the township personnel showed up and people did change their schedules. And I find that appalling, and I find them arrogant. And I also feel that by doing so, we are being fair to the other restaurants, because why comply if they're, if they're really, you just keep coming back till we get it right. So I do feel that that's out of respect to the other restaurants in this area.
Any other comments from the board members? Okay.
I don't totally disagree, but I also, a violation is a violation, but I don't think we should be overly punitive, because we know more about one place than we do about others. So my concern is that we be even-handed in this. And since we don't have a bench in terms of the staff we have to deploy, I think that's another concern because we don't know what's going on elsewhere. We're just making assumptions. We have data and evidence about one particular situation and not a whole lot of others because Larry is one person. So I'm not disagreeing with you, but I just don't think it should be. It is an exemplar of what can happen, but I don't think that we should make it bigger than it already is.
Is the hearing that's being held, is it by routine protocol, or is it because they're contesting their violations?
Well, what I think it is that every time we write a summary citation, the person has an opportunity to do one or two things. Either pay it, which is an admission of guilt, or ask the judge for a hearing. And I would assume, because I've never been in that position, that they consider themselves to be either innocent or hope to be reduced because the judge takes mercy on them. I can't speak to what their position is other than they've asked for a hearing. And my position is to go there to win.
Is that meeting going to be televised, or how does the public know what happened or the outcome of the
That's a district
decision?
court hearing, judicial system.
So I guess we'll get an update in November meeting about the next steps and how things are going so far with the Yang Ming. And also, I think in this month, I hope to be in contact with Mr. Zinkowski via email to continue to talk about some of the recommendations that we've had as a board or some of the feelings we have as a board in going into the policy that's going to be behind food inspections into the future. So I'm hoping that we can
If I could say this,
move that along.
one of the things that makes it difficult to do more frequent inspections is food facilities typically open up 10 or 11 o'clock in the day. They don't open up at 8, most of them, unless they're the few that sell coffee and breakfast, and they're few. So the opportunity to get in them in more than 2 or 3 a day is difficult. Some days I can't get in any of them because I have those other issues. So and then the schools are required to do inspections twice in the school year. And to me, that's really the priority, schools, because our children are our number one resource, go there to eat their lunch. So that's where I kind of prioritize where I'm going at. But it is hindered by the fact that their hours of access are reduced.
Thank you. Jim, yeah.
I don't, I think there has to be more supervision in their case because of their track record. In the case of Yang Ming, I don't know that the answer is more frequent inspections because I don't know truly, the main issue that we're dealing with is the cockroaches. I don't know that you're going to see them if they're there. I just don't. Because of the nature of cockroaches. Would it be possible to have them put up at their own expense video cameras trained on surfaces where if there are cockroaches, they will come out at night? That way, you could look in on them at any time and they would be, the cameras would be dialed in to the township so that they could be monitored anytime, you could look at what happened at 3 a.m. there.
I would have to consult with our solicitor to see if I can do that.
Okay.
But one of the things we have done was the old exterminator that they were using is gone. We have a new exterminator that has one heck of a track record.
Great.
Who is much more frequent in his visits and his service. I will be making unannounced way more frequent visits. I am going to give him a lot of attention. I don't want to say what that frequency is because I don't want to have him looking for me.
Okay.
I like that.
Great.
We do have to move out of the room by 6, so I want to get to some more just old business very quickly. We had discussed a bit last month about meeting times and meeting days for the Board of Health, and I think I haven't heard from anybody specifically on the board yet about times that would be convenient for them. And I think that between myself and the township manager, we could figure out what will work for this room or for a place for us to have this meeting. So if anybody this month again has any thoughts on meeting times, meeting days that would be good for you folks, please let me know. We'll move into new business, and I think the first thing I'd like to speak about in new business is welcoming our new intern today. Ms. Sheena, could you tell us a little bit about our new intern?
Sure, thank you. Amelia is our new intern. She's a sophomore at Radnor High School, and we're thrilled to have her. We had several applicants, and she definitely stood out as a wonderful student and a wonderful candidate, so we're thrilled to have her. So welcome to the Radnor Township Board of Health. She's had some experience at Paoli Hospital, correct?
Actually, no, I just recently applied, so I am.
Waiting to hear. Okay, well, that's ambitious.
Yeah, I recently applied for Paoli Hospital, so I am hoping to get accepted, but I won't know if I am or not until later this year.
Okay, well, wonderful. So she writes for the Radnor High School newspaper, and she's thinking about spreading some awareness and ways to solve Radnor Right newspaper and some other public health issues that we can identify over the year, and you can participate with us and maybe have some impact on some public awareness on special topics. So is there anything else you want to add?
Well, I'm just really honored to be part of the Radnor Board of Health, and I hope that I can make a difference and also learn more about health issues over the course of this year.
Okay, well, wonderful. Well, thank you, and we're really excited to have you.
Thank you.
Thanks so much. And there is one more intern, I believe, is not in attendance tonight.
Yes.
Okay, his name?
I don't know if I should announce him. Okay, yeah, we have another person we selected, so hopefully they will be at the next meeting in November.
And we'll obviously through the year be helping you out with what we call the student project, and we look forward to your input in our discussions. Thank you. Okay. The second order of new business, just to let everyone know, Dr. Humphrey and I were in touch a bit over the month. Larry had emailed me that the EAC has asked the Board of Health to look through the current literature on turf fields. That would be these fields that are popping up everywhere, these artificial turf fields with the little rubber beads that are in the turf field to keep them soft and squishy and injury-free. NBC News over the past few years has been running relatively frequent stories about cases of people who believe that these fields are related to higher rates of cancer. Now, these are not true studies that have been done. They are based more on experience where people who play on these fields frequently feel like there's a higher incidence. But there is some literature out there. Dr. Humphrey had looked at this back in 2011, I believe. So we're going to he feels the best way to go about this is just getting the literature together and maybe having a committee of a couple of us off of the Board of Health and maybe someone from the EAC to review the information, present it to the board in kind of like a sort of a summary manner so we can all look at the information and make a decision about any recommendation we might have to the EAC or to the Board of Commissioners. Similarly to what I think happened a couple of years back when we discussed glyphosate at length, the herbicide glyphosate, where I sort of put together all the current literature and gave a summary report to the board. So this is something that we'll speak of more as the season goes on, I am sure, as these fields are popping up everywhere. And Mr. Teltone, just real quickly, I don't know if there's any availability, but I think in 2011, Mr. Josh Hilbert and some others had a statement about the fields at that time, and I'm a little bit of a loss of where to find information about this, about their discussion prior.
That was in 2011?
I believe so. Again, according to Dr. Humphrey, if he comes next meeting, he can talk about it further, but it looks like in 2011, the Board of Health and the EAC made some kind of statement on this debate, and I was
Regarding turf fields.
about turf fields.
I remember the discussion. I can take a look.
Okay, so that'd be excellent. So at least a start for us to sort of work from there. So I appreciate that. I don't believe there's any other new business that I had. Anybody else have any other new issues, concerns? Okay. Hopefully with a larger board next month, we'll have some more information. Okay. So we'll probably move on to announcements. I think, Dr. Capuzzi, you want to do next month for zoonosis talk?
Yeah.
Okay. So we'll have a talk from Dr. Capuzzi next month on zoonoses. So a few things back to announcements here, or onto announcements rather. Any updates, Marianne, from last month where we spoke about the status of the Health and Hero Challenge vote on the internet?
Thank you for asking, Dr. Foreman. All the votes are in. I'd like to thank the residents and the Board of Health that voted for Laura Offit, MD, as our health hero. We should know in about a week who the finalists are, but in my opinion, she's a winner, and in our opinion in Radnor, she's a winner already. So she has had a lot of good interaction with this, and I do believe she will be a name that you will read in some of the bigger magazines, and life will go on. And she all started here. So thank you to all of you, and look for the results in about a week.
It's like there was many rounds of voting, different groups of people I saw when I went to the website and checked it out. Interestingly enough, the CDC, the Centers for Disease Control, has a webinar tomorrow, Tuesday, October the 20th, on e-cigarettes, a topic that our board has brought to the public's attention last year, and a few of the experts in pulmonary care, as well as cigarette experts across the country, cigarette disease experts across the country, will be participating tomorrow. And it should be an interesting lecture. I'm going to try to get to that at lunchtime tomorrow if I can as well. I didn't see the timing. It might be one of these webinars that you can watch through the day. I'm fairly sure they usually repeat these things when I see on the CDC website. You can watch it through the day. Outbreaks in the U.S. of Salmonella have been reported in 51 people in 16 states from pet turtles, just so everyone's aware. In the past few months, even if a turtle looks healthy and clean, it can carry salmonella of a number of different species. So we need to do careful hand washing with anyone who has pet turtles. That was something that I read about today as well. And then tomorrow is also Global Hand Washing Day. Believe it or not, there is a Global Hand Washing Day. And I think that brings us to our most important topic of the fall for residents of the township, and that would be flu prevention. Obviously, the most important thing about infection prevention that we can do is good hand washing. Shaking hands, touching surfaces, all spreads disease as we put our hands to our mouth and nose. So hand washing is obviously important. There are specific instructions about how to wash your hands properly and how long it takes and how much soap and friction you should be using. So a good idea would be Googling Global Hand Washing Day, which has a lot of great recommendations, as well as getting your flu vaccines, either the injectable or the nose spray if you're under 55, as a good way to protect yourself from influenza in the winter season. Does anybody else have any other announcements, please?
I wanted to bring your attention to a lecture series that was originally designed for health professionals, but has now broadened its scope and is open to the public as well as health professionals, and happily College of Nursing in Villanova has gotten it endowed. We've had the lecture series for a number of years. You've missed the first one, but we have one on the 17th of November, and then I will get additional flyers that can be given out, and perhaps somehow I can get them up on the website. We will be looking at, in particular in the spring, in March, we'll be looking at the whole business of vaccinations, the scope of issues. And in April, early April, the cervical cancer screening, and particularly a program that one of the nurse practitioners has been been developing and implementing both in rural Maine and in Haiti, two very different kinds of places. But this is an ongoing series, but now it has taken on a new life, and I want to be sure that the public recognizes that it's open, free to the public, and they're all welcome. So I will try to get you more information. I'll leave this with you, Dr. Foreman.
What's the title of the series?
It's well, now that it is endowed, it is the Naratil, Naratil Family Health and Human Values Lecture Series. Naratil family is not local, but their daughter is in our program, and they're people from Connecticut that felt this was a very good opportunity for them to contribute to
Wonderful.
health
Great.
and healthcare education.
Great, we'll get that up on the website as well. Thank you. Great. Any other announcements from anybody else? No? We will call this brief meeting to a close then, and we will see everyone on November, is it 16th, Larry, is the next one? I think it's 16th. Okay, 16th, which is a Monday at 5 again. Thank you.